Are you on your feet all day and really need some relief? If so, we have got you covered this morning. It is Foot Health Month, and joining us live this morning is Hartford Healthcare's Dr. John Dankert with the Connecticut Orthopedic Institute at St. Vincent's Medical Center to help us out with some very timely tips. Doctor, great seeing you this morning. You are a foot and ankle surgeon, so what could be causing people that nagging pain that so many people experience on a day-to-day basis?
Good morning. Thank you for having me. So look, I see a lot of people with different types of foot and ankle pain. One of the things I most commonly see in my office are people that come in with plantar fasciitis. What can I tell you about plantar fasciitis? How much do you know?
I don't know much. You can educate all of us.
Okay. So I usually use the metaphor that the plantar fascia on the bottom of your foot is a thick rope or a cable that helps maintain the arch of the foot. And just like a rope, as you go through life, that rope can become frayed, it can become damaged. And often when people come in, they tell me, I've got terrible pain on the back of my heel. The pain hurts first thing in the morning. It hurts when I get up, when I take those first few steps. And that's usually what starts that conversation about how is the best way to take care of that plantar fasciitis for them. Now, there's a number of different ways that you can take care of it. Some of my favorite are making sure that they're in the appropriate shoe wear, that they're appropriately stretching their foot and ankle, that they're strengthening and conditioning that foot and ankle. And also, I like to usually get them into physical therapy, let the physical therapist work on helping take care of that heel pain.
Let's talk about shoes right now. You brought it up. How do you know with sneakers, for example, or really any shoe, how do you know when you have the right shoe? And especially with so many people buying shoes online now, they aren't trying them on in the store like the old days. How do you know when you've got the right pair?
I always tell people, I have a handout that I like to give patients, but I always tell them you have to go into the store. You got to go try those shoes on in person. Most important thing is to have your foot sized, not only from front to back, but also side to side. I see a lot of people that wear shoes that are either too small or too big, or they're wearing shoes that are too narrow for their feet. And those shoes, I think by themselves, are the fundamental reason for a lot of the pain that they're experiencing.
So how do you know when you have the right one? You really need to talk to somebody who is somewhat of an expert in a store?
I think I always tell people for the first time, you got to go to the store, you got to speak with the person at
Right.
the store, make sure you get sized, and then work with them to make sure that you get the appropriate shoe. And try a number of different shoes on. It's not just try one on and that's what you live with. You have to try a few different pairs because of how many different variations are out there these days.
What about those over-the-counter insoles that we see in stores? How effective are they?
Yeah, I think insoles have a purpose, they have a role, and I do use them from time to time in my patient's care. I think most important is making sure you have the proper shoe, and then if you need to fine tune the conformation of the shoe to your foot, that's when an insole does take a place and plays an important role in that care.
Doctor, let me get you out on this. When should somebody go and see a surgeon or a specialist like yourself?
Look, I know I think it's easy to say over a call or a phone, like, look, your foot pain could be this, but there's a number of different reasons and there's a number of different things that can even mimic plantar fasciitis. If you have foot pain and it's stopping you from being able to do what you want to do, it's stopping you from being able to go to work, that's when you should come and see your local foot and ankle surgeon and come talk to one of us and let us make sure that you're on the right path to getting you back to what you love to do.
All right, doctor, great seeing you. Appreciate the information this morning.
Thank you. Have a nice day.
All right, you as well.